If you've ever walked out of your OSCE feeling like your brain just melted, you are definitely not alone. But are you making these mistakes? Hello, you're on Shift with Sian, the platform that empowers student nurses with the knowledge, the tools and the support to build confidence in practice. Now, the OSCE, or the Objective Structured Clinical Examination, is one of the biggest challenges that student nurses face. It's that practical exam that proves that you can safely apply theory to real-world nursing practice. And yes, it's one of the final steps before you get that PIN number. There is good news though. Most OSCE mistakes are common, predictable and totally preventable. So in today's video, I'm going to break down the 10 most common OSCE mistakes that nursing students make and sharing exactly how to avoid them, so you can walk into your exam calm, confident and ready to pass. Let's start with a quick refresher. So what actually is an OSCE? It's a practical exam where you move through a series of short stations, each testing a specific skill or scenario, like taking observations, giving a handover or performing a wound assessment. You're assessed by an examiner who scores against a clear marking criteria. It's not about perfection though, it's about showing that you can think, act and communicate safely as a nurse. Alright, let's jump into those common mistakes and how to fix them. Number 1 then, forgetting to introduce yourself and confirm identity. Now this is one of the most common and most avoidable mistakes. In the nerves of the moment, many students skip straight into the task without introducing themselves or confirming the patient's ID. Now every station should start like this. Hello, my name is Sian, I'm the student nurse. Can I confirm your full name and date of birth, please? It's about patient safety and it's an easy mark to earn when you make it a habit. Next up, hand hygiene. You will lose marks if you forget it. It's one of the first things that assessors look for. Do it before and after patient contact and say it out loud during your OSCE. I will now perform hand hygiene. It shows awareness of infection prevention and it's part of your safe practice. By the way, I have created for you a 5 moments of hand hygiene resource for you to download for free as a prompt on your to use for placement and when you're prepping for your OSCE exams. I will put the link for that in the description. Mistake number 3, skipping consent and communication. OSCEs aren't just about those clinical skills, they're about how you communicate. Many students rush this part or use really technical language. Use simple and clear words and gain verbal consent. Something like, I am going to check your wound now, is that okay? It shows compassion, respect and professionalism, all things that the examiner is marking you on. Number 4, not following a framework. So when you're under pressure, it's easy to jump between steps, but OSCEs love structure. Use frameworks like A, B, C, D, E, the S-bar or SOAP to give your assessment. They show logical thinking and safe care. If you go blank, say what you would do next. Assessors give you credit for that. Practice applying these frameworks in real situations so that it becomes second nature. Download an S-bar framework to use as a prompt. It's free and I'll put the link for that in the description. Number 5, panicking when you don't know something. This is a huge one and we've all been there. If you freeze in your OSCE, don't panic. Take a breath, collect yourself and remember, silence for a few seconds is okay. If you're unsure about something, say, I'm not entirely sure, but I would check with my mentor or the trust policy. This shows self-awareness and safe practice, both of which examiners love. Number 6, forgetting to document or report. You can do everything clinically right, but if you don't hand over or document your findings, you will lose marks anyway. Always close that loop with clear communication. Use S-bar when handing over or escalating and document factually. If you are struggling with handovers, I've got a complete handover pocket pack that walks you through how to give safe, effective and confident handovers in emergencies, when escalating deteriorating patients, and what to say for bedside handovers and more. I'll put that link below. Number 7, don't overlook patient comfort and dignity. This is a big one because in the rush of ticking those boxes, don't forget the human being in front of you. Offer privacy, maintain dignity, use blankets and ask if they're comfortable. Empathy scores marks and it's what's going to make you a good nurse. Remember, treat your mannequin or your actor like they're your real patient. Number 8 then is poor time management. One of the biggest reasons that students lose marks is for running out of time. You spend too long on one task and then suddenly that bell goes and you haven't finished. OSCEs are time limited for a reason, and it's to test your ability to prioritise. So practice each skill under time conditions, use a stopwatch. Focus on the must-do safety steps first and then go to the should-do tasks. If you forget something, say out loud, "Oh, I would go back and check this now." You will still get credit for that. Time awareness shows confidence and control, 2 things that make examiners take notice. Number 9 then, so forgetting equipment checks or PPE. This is such an easy mark to lose, but it's just as easy to fix. Many students forget to check their equipment or skip the PPE altogether. Before you start any procedure, say out loud, "I've checked the equipment is clean, in date and working correctly." It takes seconds, but it proves that you understand infection prevention and patient safety. Always use the correct PPE for the task, and if you're unsure, check the trust policy or your university policy. Those few seconds can be the difference between that pass and that fail. Finally, number 10, not reflecting or learning from feedback. You pass or you fail, you breathe a sigh of relief that it's over and you move on, but reflection is where the real learning happens. So after every mock or OSCE, take 5 minutes to jot down what went well and something that you need to improve on for next time. Use a simple structure like Gibbs' reflective cycle to keep it focused. Reflection isn't just for essays, it helps you to build confidence and self-awareness and professionalism. If you want help structuring a reflection, I've got a free Gibbs reflection prompts that you can download. It's in the description. Here's the truth, OSCEs aren't there to trick you. They are designed to check that you can be safe, compassionate and professional. So if you can introduce yourself and confirm ID, prioritise safety and consent, communicate and document clearly and stay calm under pressure, you're already doing better than you think. You've already been practicing these skills every day on placement. This is just your chance to show them. So that you can remember the important things that you will lose marks for if you don't do, I have created a free OSCE exam checklist. It's a printable guide to help you remember these key steps for each station so that you can walk in there feeling calm, organised and ready to pass. The link for this is in the description. If you found this video helpful, hit like, subscribe and share it with another student who's about to do their OSCE prep too and needs that little bit of a confidence boost. Be kind to yourself, we've got this.